Assalamualaikum student. Today our topic of discussion is blepharitis. You know at the end of this word there is TIS. Thus its mean inflammation. Here we can say inflammation of eyelid. Now we will explain the types of blepharitis. There are two types of blepharitis. Anterior blepharitis and posterior blepharitis. Now we will explain these further. Now, if we talk about anterior blepharitis, there are two types of anterior blepharitis: ulcerative blepharitis, squamous blepharitis. If we talk about the posterior blepharitis, this is only Meibomian blepharitis. Now we will explain the exact definition of blepharitis. This is the inflammation of eyelids. We are going to talk about first type of blepharitis. This is ulcerative blepharitis. Now, what is the definition of ulcerative blepharitis? The acute chronic infection of eyelash follicles associated with glands of disease and glands of mole. This is called as ulcerative blepharitis. What is the cause of ulcerative blepharitis? The agent for ulcerative blepharitis is Squamous aureus and Squamous epidermidis. Okay? This is the bacteria which causes the ulcerative blepharitis. Now, what are the features of ulcerative blepharitis? Features: the chronic irritation, lacrimation, itching, photophobia, crust formation, red oedematous lid margin. All these are the features of ulcerative blepharitis. In case of ulcerative blepharitis, a patient's lids feel these features. Now, what are the complications of ulcerative blepharitis? First one is trichiasis. It means eyelashes directed inward. In normal position, the direction of our eyelashes is outward, but in case of the direction of eyelashes become inward. Poliosis. Here there is the loss of color of eyelashes is called as poliosis. Meibomian. The loss of eyelashes is called meibomian. Remember and listen. The loss of eyelashes is called as meibomian. If the color of eyelashes, the loss of color of eyelashes is called as poliosis. And recurrence of lesion and stye. These are the complications of ulcerative blepharitis. Treatment here. For the most important treatment is eyelid hygiene with the help of baby Johnson shampoo. Second one, antibiotic eye ointment. Third one is topical steroid. Fourth one is artificial tears. Now we are going to explain squamous blepharitis. It is also anterior blepharitis. What is the definition of squamous blepharitis? This is a disorder of glands of disease. There is problem in the glands of disease and glands of mole. Then a squamous blepharitis develops. The exact cause of squamous blepharitis is unknown. Now we are going to explain the features of squamous blepharitis. Deposition of white material on the eyelashes, falling of eyelashes, dandruff, irritation, discomfort, and waxy pain of eyelashes. These are features of eyelashes. We talk about the complications. All the complications of squamous blepharitis are same as that of ulcerative blepharitis. I will tell you that again. Trichiasis, poliosis, meibomian. These are the complications of squamous blepharitis. What is the treatment of squamous blepharitis? The same treatment: eyelid hygiene, antibiotic eye ointment, topical steroid, artificial tears. We will also add the selenium sulfamide shampoo in the treatment of squamous blepharitis. The third and the last type of blepharitis is Meibomian blepharitis. This is the posterior type of blepharitis. What is the definition of Meibomian blepharitis? The diffused inflammation of Meibomian glands characterized by hypersecretion of gland is known as Meibomian blepharitis. The exact cause of this is also unknown. What are the features of blepharitis? Frothy, it means foam like material on the eyelashes. and everting of eyelid shows the white line of meibomian glands on eyelid secretion on pressing of eyelids. What are the complications? Same complete trichosis, poliosis, medrosis. These are the complications of Meibomian Nitrous blepharitis. Treatment, the same treatment. Eyelid hygiene, antibiotic ointment, topical steroid, artificial tears. The things we will add that is systemic. We also add systemic antibiotic in the treatment of Meibomian Nitrous blepharitis. The tetracycline tablet, 250 mg doxycycline antibiotic, 100 mg. We will also add these things in the case of Meibomian Nitrous blepharitis. This was the theoretical that I have explained. Now I will show the images of all types of blepharitis. You can say, and you can also easily differentiate from the images. This is you. If you have any questions, you can ask from me. And I'm going to show you the images, pictures of this all types of blepharitis. In this picture you can see this is the ulcerative blepharitis. This is like an ulcer type. If we will remove these foam like material, then there will be release of blood. You can see clearly this is ulcerative blepharitis. Now we are going to compare this picture with Squamous blepharitis. See this picture, and now this is the second type of blepharitis. This is Squamous blepharitis. There is matting of eyelashes. It's meant because of the dandruff like material on the lashes. Because of that dandruff like material, there is matting of eyelashes. Now I am going to show you the third type of blepharitis, that is Meibomian Nitrous blepharitis. Here you can see the white material on the eyelid margin. If we will press these material, there will be eyelid secretion from these lids because of Meibomian glands. These three are different types of blepharitis. I have showed you from these pictures. Now I think you can explain these different types of blepharitis, and you can differentiate these different types of blepharitis. If you have any question, you can ask from me. Thank you so much.